Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College and Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and the site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, March 27th, 2023. Daily COVID-19 cases, reported cases, hospitalizations, and deaths continue to trend downward with no new troublesome variants on the horizon. Nationally, average number of new reported daily cases are down 34% over the past 2 weeks to under 20,000 per day, or a rate of 6 per 100,000 of the population. And hospitalizations are down 14% to 22,522 per day, or a rate of 7 per 100,000. Similarly, average number of daily deaths is down to 255 per day over the past 14 days, the lowest it's been in over a year. All good news. In Tennessee, new cases of COVID-19 have decreased by 40% from 2 weeks ago to an average of 425 cases per day, or a rate of 6 per 100,000, slightly below the national average. Hospitalizations likewise are down 32% over the past 2 weeks at a rate of 5 per 100,000, also below the national average. Deaths have decreased across the state by 25% over these past 2 weeks to 4 per day. 4 counties in Tennessee remain in the CDC's yellow zone for community spread. They include Scott, Washington, Carter, and Unicoi, all in eastern Tennessee. So today I wanted to do a review of where we are at with COVID vaccines, as many people may have lost track of which shots they have had or need to get. For adults aged 18 years and older, the CDC's recommended vaccines are as follows. For both Pfizer, BioNTech, and Moderna, the primary series includes 3 doses with a 4th dose as a booster. For youth 12 to 17 years of age, recommended primary series of vaccines, i.e. the first 3 shots, are limited to Pfizer, while the schedule is the same as adults. The 4th dose or booster can be either Pfizer or Moderna. For children 5 years of age to 11, only Pfizer vaccines are recommended, and the schedule is the same as for the other groups, 3 doses in the primary series and a 4th dose as a booster. For children 6 months to 4 years of age, only Pfizer is recommended by the CDC with 3 doses in the primary series. The FDA recently approved emergency use authorization for Pfizer's updated COVID-19 vaccine to allow children ages 6 months through 4 years to receive a 4th dose or the booster, at least 2 months after completing the primary series of 3 shots. As I've reported before, the federally declared public health emergency is scheduled to end on May 11th. There is more clarity on the changes that will occur. It's important to note that the administration's continued response to COVID-19 is not fully dependent on the COVID public health emergency, and there are significant flexibilities and actions that will not be affected as we transition from the current phase of our response. Recent information on the U.S. Department of Health and Human Services website reports the following. Those things that will not be affected by the ending of the public health emergency include after May 11th of this year, when this transition to traditional health care coverage occurs, many Americans will continue to pay nothing out of pocket for the COVID-19 vaccine. Vaccines recommended by the Advisory Committee on Immunization Practice are a preventive health services for most private insurance plans and will be fully covered without a copay. Currently, COVID-19 vaccinations are covered under Medicare Part B without cost sharing, and this will continue. Medicaid will continue to cover all COVID-19 vaccinations without a copay or cost sharing through September 23, 2024, and will cover ACIP recommended vaccines for most beneficiaries thereafter. Federally qualified health centers will still be able to offer COVID-19 vaccines without charge. Out-of-pocket expenses for certain treatments may change, however, depending on an individual's healthcare coverage, similar to costs that one may experience for other drugs through traditional coverage. Medicaid programs will continue to cover COVID-19 treatments depending on an individual's healthcare coverage, similar to costs that one may experience for other drugs through traditional coverage. Major Medicare telehealth flexibilities will not be affected. The vast majority of current Medicare telehealth flexibilities that Americans, particularly those in rural areas and others who struggle to find access to care, have come to rely upon over the past 2 years, will remain in place through December 2024. Due to the Bipartisan Consolidated Appropriations Act of 2023 passed by Congress this past December. Medicaid telehealth flexibilities will not be affected either. States already have significant flexibility with respect to covering and paying for Medicaid services delivered via telehealth. State requirements for approved state plan amendments varies as outlined in the Center for Medicare and Medicaid and CHP Telehealth Toolkit. This flexibility was available prior to the COVID-19 public health emergency and will continue to be available after the PHE ends. Similar to Medicare, these telehealth flexibilities can provide an essential lifeline to many, particularly for individuals in rural areas and those with limited mobility. Access to buprenorphine for opioid use disorder treatment in opioid treatment programs will not be affected. Access to expanded methadone take-home doses for opioid use disorder treatment will not be affected either. So what will change? Certain Medicare and Medicaid waivers and broad flexibilities for healthcare providers will no longer be necessary and will end. For Medicaid, some additional COVID-19 public health emergency waivers and flexibilities will end on May 11th, while others will remain in place for 6 months following the end of the public health emergency. But many of the Medicaid waivers and flexibilities, including those that support home and community-based services, are available to states to continue beyond the public health emergency if they choose to do so. The requirement for private insurance companies to cover COVID-19 tests without cost sharing, both for over-the-counter and laboratory tests, will end. Reporting of COVID-19 laboratory results and immunization data to the CDC will change. The ability of healthcare providers to safely dispense controlled substances via telemedicine without an in-person interaction is affected. However, there will be rulemaking that will propose to extend these flexibilities. For most, the continued decreases in reported cases, hospitalizations, and deaths due to COVID means putting the masks away and getting back to normal, just in time for spring. However, precautions still need to be observed by persons in high-risk categories for severe COVID outcomes, including those who are immunocompromised, have multiple chronic health conditions, or are over 70 years of age. These individuals will want to continue to be cautious, particularly in crowded indoor spaces. For now, this is Dr. Paul Juarez from the Tennessee SEAL and HealthWorks at Meharry, wishing you health and wellness. Be safe.